Hi guys, welcome again to another episode of Labor Room. And as usual, I'm your lovely host, Dr. O. Okay, today what are we talking about? Last week I promised that we're going to talk about something really interesting. Yeah, we've talked a bit about this before, but I did say I was going to talk more about it. So I was going to go more into detail. What exactly am I talking about? How to identify a bladder infection in pregnancy. Yes, how to identify a bladder infection. So what is a bladder infection or what is a urinary tract infection? Usually an infection that ascends into the urinary tract from the urethra into the bladder. Can be caused by bacteria, it can be caused by fungi. And the infection can actually ascend upwards into your kidneys. And that's when it becomes a major problem because, kidney infections, they could get complicated and they could actually spread around the body. So you don't want it to get to that stage. So how do you identify a bladder infection in pregnancy? First of all, you need to know that as a pregnant woman, you are more prone to having urinary tract infections. Yes, because of the anatomy of the body, the changes, hormonal changes that happen and all that. You are more at risk of having urinary tract infections. So first of all, you should always take precautions. What kind of precautions can you take? Avoid wiping from back to front when you use the toilet. So when you use the toilet, always wipe from front to back so that you don't transfer bacteria and all sorts of microorganisms from the anus to the urethral area and the vagina. So always wipe from front to back. Then drink a lot of water. Water helps to prevent urinary tract infections. Bacteria usually breed better when the urine is more concentrated and all that, but water helps to flush out the urinary system and prevent frequent occurrence of urinary tract infection. Okay, that's my 2 tips for preventing infections. Now let's go to the topic of the day. How can you identify a bladder infection? So a bladder infection, when you have a bladder infection, you notice that when you go to the toilet to pee, like I said before, you experience this pain or burning sensation when the urine is coming out. It can be really painful and the burning sensation can be really uncomfortable. And you notice that it happens every time or almost every time you go to the toilet to pee. And then when you go to pee, sometimes the urinary stream is not strong. It's just like small drops of urine that are coming out, it's not flowing like it usually should. And sometimes you notice that you feel like you have to go to the toilet frequently. Even when your bladder is not full, you just feel like you have to go to the toilet. Sometimes you would have just come out from the toilet and less than 5 minutes later or 10 minutes later, you're off to the toilet again to go and pee. And each time you go, it's not like something much is coming out. It's just something little each time, and there's this pain, there's this burning sensation. Mind you, it's not every one of the symptoms you have. You can have one or more. But once you notice that you're having at least one of the symptoms, then it might be a red flag sign for a urinary tract or bladder infection and you need to report it to your doctor. Another sign is if you're having lower abdominal pain. So the lower part of your abdomen, around where your bladder is, you just notice that it's constantly paining you and you don't know what's the cause of the pain. Obviously, you're not menstruating or your period is not coming because you are pregnant and you can't think of any other thing that can cause pain. Of course, like we discussed in our previous podcast, there are so many things that can cause abdominal pain and we specifically discussed the ones that you must not ignore. But urinary tract infection is one of the reasons you can have lower abdominal pain. So if you're having a lower abdominal pain, you can start to think that maybe I might have a urinary tract infection. You should report it to your doctor immediately. So I've talked about pain and burning sensation while urinating. I've talked about lower abdominal pain. I've talked about frequency, having to go to the toilet a lot. Then another thing you might notice is if there is blood in your urine or your urine becomes cloudy or foul smelling, this might be a sign that you have an infection in your urine. So you must always observe your urine all the time, Don't wait until you go for antenatal and they give you a bottle and say, put urine inside so that we can test your urine and all that. Even after peeing in the toilet, make sure you always try and look and see what's the color of the urine. Is it fine? Is there any blood? Is it foul smelling? Try and observe these changes so that you can pick it up on time and report it to your doctor. So these are some of the subtle symptoms you notice of urinary tract infection. And obviously when you feel this, you know that something is wrong. But then there are some major symptoms that when you have this one, you know that the problem has really gotten worse. Most times when you have these symptoms I'm about to tell you about, it means that the infection has traveled all the way up to the kidneys, and the kidney is now affected. And that can be a really, really complicated situation for you, especially when you are pregnant. Treating that kind of infection when you are pregnant can be complicated. So you don't want that to happen. That's why you have to pick it on time. So what kind of symptoms do you notice if it has spread to your kidneys? You notice that you're having fever. So apart from all these other symptoms I mentioned, you'll be having fever, your body will be hot, and it's not malaria, it's not any other cause. Then you'll be having flank pain or back pain. So at your back, towards the sides of your back, mid-back, you just feel this sore, dull, aching pain. It might be on one side or it might be on both sides. And it's just constant. There is really painful. Sometimes the pain can actually be really, really bad. It might be a sign that you have a kidney infection. And then if there is nausea and vomiting, if you are feeling nauseous all the time or you're actually vomiting, it might also be a red flag sign that's accompanied with all the other symptoms I mentioned. Sometimes also, like I said, you can notice pus in your urine or blood in your urine. So blood in your urine is never a good sign. It's always a sign of infection, either in the kidneys or in the bladder. Or it might even be a sign that you have stones, either kidney stones or bladder stones. So all these things should not be taken for granted. Make sure that if you notice any of the symptoms I mentioned, report to your doctor. Drink a lot of water, wipe from front to back, so that you can prevent having such infection. And don't attempt to treat the infection on your own. Always go to the hospital. It's always better. You are not a doctor. You don't know what to look out for. It might be anything. You understand? So make sure you always report it to your doctor for the safety of you and your baby. So I hope you've been able to learn one or two things in this really short podcast. Next week, I have something more interesting for you, and I'm going to take less of your time. So thanks again for listening this week, and talk to you again next week. Have a lovely week and weekend ahead.